I'm excited to introduce our third and final patient panel of the conference. Caitlyn Perkocha, a recent college graduate and liver disease advocate, will begin by sharing more about her experience with this disease and how she's evolved both as a patient and a health advocate. Welcome, Caitlyn.
Hello. Okay. Erin kind of already introduced me. My name is Caitlyn Perkocha. I'm from California. I'm 22 years old. I'm 23 years old. Sorry, my birthday was this week, so still getting used to that part. And shout out to my mom, my dad, and my two cousins here for supporting me. Okay. So I was a normal 17-year-old girl having a great life. I was the captain of my soccer team, varsity soccer team, taking 4 honors classes and had an active social life. And what I didn't realize is even at 17, I was super stressed out all the time. And it started with losing my menstrual cycle and feeling tired. And that wasn't unusual for someone who was an intense athlete and who was in her junior year of high school, studying for the SAT, taking AP classes, thinking about college applications. So I wasn't that concerned about it. And I also had an exchange student staying with me to add to my stress load. And at that point, something flipped. I began to feel itchy at night all over my body so terribly that I went to a dermatologist, and that turned into blood work, and that turned into something that would change my life forever. So within a week or so of that initial dermatology visit, my primary care doctor sent me to Stanford Hepatology, where they told me that they suspected AIH, and they would need to do a biopsy to confirm. And I felt shock, horror, disbelief, felt like my body had turned against me, like I couldn't trust it, and I'm sure many of you have felt those feelings as well. And up until that point, I had this belief system that no matter what happened, I would be safe, I would get better, and my parents could tell me that. But now I was being told that I had a chronic illness, that there's no cure, there's just treatment and hope of getting into remission and then staying in remission, which caused huge amounts of stress for me on top of what I was already feeling. And so I undergo the biopsy confirms it, and I start treatment at Stanford with prednisone. So despite the diagnosis, kind of similar to Brooke, I was determined to keep doing all the things I had done before. And it was 2 weeks no contact after the biopsy, so I started going to the weight room. And in the weight room, I introduced myself. I'm like, hi, I'm Caitlyn. The lift coach is like, why are you here? You've never been here before. And I said, I just had a biopsy and I can't do contact. And he goes, wait, are you so-and-so's girlfriend? So-and-so is in the last slide next to me in the hospital. And I said, yes. How did you know? He said, well, he missed. Oh, yeah. Sorry, I haven't been changing slides. Okay, so-and-so right there in the hospital. And he's like, yeah, so-and-so missed lift last week to go visit his girlfriend in the hospital who was getting a biopsy. So he put 2 and 2 together because in a school of 500 kids, obviously I was the only one getting a biopsy that weekend. So that was just a funny story, and this lift coach ends up being a big mentor to me. And 18 days after the biopsy, I play in the soccer game versus our arch rivals. So that's me with my dad and my sister, and me hugging the girl who scores the winning goal. And that was just a huge moment because it was like, yeah, like I came back despite the odds and still showed up for my team. Like I was captain, I had to be there. And so then a few months later, spring 2018, I transferred my care to UCSF, as my dad has mentioned, because at Stanford, our doctor didn't have a lot of experience. We were feeling kind of uneasy in our hands, and I guess I wasn't getting better. I don't remember that part. But we ended up getting placed with the head of pediatrics gastroenterology / hepatology, and she made me feel so confident in the possibility of recovery and in her care. But despite feeling in better care, I was extremely stressed out, felt anxiety about a lot of things. If any little thing happened, I thought it could be something big because I thought something little like fatigue was nothing, and then it was something huge. And I started therapy and medication, but I still had stress, and I thought it was normal. And in addition, my doctor had me on a 2-week blood draw schedule, and I was extremely scared of needles, which I'm sure a lot of people can understand. And so here's a little aside with how I kind of overcame this hurdle. So what basically happened was I started with little steps. First, I had everything to comfort me with me. So I had a loved one, my mom or my sister who's up there with me. They would hold my hand. I would do jumping jacks and push-ups, drink water, ask for the heating pack on my arm, ask for the baby needle, do all the stuff. And then, as I started to gain more confident, I slowly peeled each of these things away until I was doing it by myself, eyes open, able to talk to the phlebotomist. And eventually, it became a task, and I'm fine with it now. Like you saw, I got the acupuncture needle in, and I started to make it funny. So I put these fake tattoos on that says insert here, and they'd be like, roll up your sleeve, and it's there. And the phlebotomist and I would just have a great laugh, and it kind of made it like a little highlight of my day rather than an onerous task. So those are just some tips I have for that. And now AIH and going to school. So I felt like I kept up with life and school pretty well, but I got called into the dean's office for too many excused absences. The dean accused me and my mom of working together, my mom creating fake doctor's appointments so that I could cut class and cheat the system. Whether you choose to share your diagnosis or not is your choice. And I chose not to share with everyone. I mean, I was still excelling in sports, excelling in school, and I told my teachers and coaches at the time to create a more safe environment, but I didn't feel the need to tell everyone what was going on. And I really did not want to explain myself to this man after being so harshly accused, but I was forced to. I had to tell him about my doctor, about my situation, and we had no personal connection. So that was just a really uncomfortable moment, and just sometimes people suck, and you're gonna have to deal with it, which is kind of part of the disease. And so I end up graduating high school, won the CCS championship, which is just our section, and it looked like I had overcome my disease kind of from the outside, and I got into my dream college. But I still felt very stressed, and it felt like a struggle to exist at the pace of life that I was trying to exist at. And then during my sophomore year of college, some health complications arose. So I was diagnosed with Hashimoto's, and I started the thyroid medication. And I was on Nexium to protect my stomach from the steroids, but I was off steroids at this point. I was just still on the Nexium. And so we moved the Nexium to nighttime, thyroid medication in the morning so they don't mess with each other. And all of a sudden, my acid reflux starts acting up, and we're unable to rein it in. And my GI suggests upping the Nexium because if you have too much acid in your stomach, that would, in theory, help because Nexium is an acid reducer. And then I see my new adult primary care or internist, and she suggested that the fact that I had been on Nexium long term could have been a huge problem for me if too much acid wasn't the issue that I was having. And it could decrease your stomach lining and bone density and all this other stuff that I was like, oh my God, like what? So it was at this point that I realized that I was kind of in this problem cycle that I'm sure many people can understand or have been through themselves. And for me, it kind of went like this. So problem number 1 was getting diagnosed with AIH. Solution number 1 was getting the steroids. Problem from steroids is a lot of things, such as stomach lining issues, bone density issues, glaucoma possibly. So then new solution, how do I go back? We're just going to wait there. Okay, new solution was that Nexium, but chronic Nexium usage may have adverse effects on your gut barrier, your digestive capabilities, and as well could have contributed to a lower bone density. So solution 3 at the time was kind of a misdiagnosis, was more Nexium. And another problem that I was undergoing that maybe others in here have experienced is you lose your menstrual cycle when you're going through a disease like this. The solution was birth control. And the problem with that is that it suppresses your pituitary and you're not really cycling, it's just artificial. And for me, I didn't want that. I wanted to actually be healthy because it's a vital sign in women. You know, if you're cycling, that's a sign that you're healthy. And so I thought, how do I solve these problems without creating more problems? And as you'll see, still had to live my life. I was about to go study abroad, so I did not explore this, and I just stuck to my regimen until symptoms became unbearable, and I got an endoscopy there. But that revealed no quick diagnosis, just chronic, non-specific gastritis. But I could still have a great time in Italy while experiencing terrible symptoms. So it was kind of like a dual experience for me. And so I come home, repeat liver labs look good, but I don't feel good. So I start to try things on my own to fix the acid reflux and stomach issues. And these things helped somewhat, but I was still suffering a lot. And at last, I get off the wait list for Dr. Stephanie Daniel, a functional medicine doctor who has a practice in San Francisco. And she said that I have this bad bacteria in my system, explains how that can be the linchpin for symptoms such as the reflux in my case. And I decided to trust her to help me on my healing journey. So I start her protocol, stop the birth control, and for the first time since I was 16 years old, I got my period naturally. So I'm like, whoa, this lady knows what she's talking about. And all of a sudden, my reflux starts to improve, and the labs are improving, and I feel like I'm starting to get my life back because that pain was pretty debilitating. Then next on the list is I graduate college. Woo! It might seem normal and like the thing you're supposed to do, but especially with a disease like this, I wanted to take a moment to celebrate this accomplishment and encourage everyone here to celebrate all their accomplishments that they're achieving despite their current situation and their diagnosis. So after grad, I kind of hit a plateau. I felt like my stomach discomfort and reflux was getting worse again, and I was just feeling stuck. And my functional medicine doctor suggested that it was likely due to stress, and I would need to retrain my brain and unwind the years of stress that I had been experiencing since my diagnosis. And so she recommended this program called Primal Trust, and I'm happy to talk more about it on the panel. And also, I started using this app called the 5-Minute Journal to practice gratitude. I just find it super easy, it's free, so I put it up there as well. And so gratitude, Primal Trust, EFT or tapping therapy, acupuncture, meditation, I start doing all these things and I feel like it's helping. Like my digestion's far better than it was when I came to her upset. And am I completely cured now? No, but I'm managing it and I'm managing my stress far better than I was before. And will my stress ever go away? No. No one's stress just goes away, but your capacity to handle the stress will increase. And the more your capacity increases, or at least for me, as my capacity to handle stress increases, the more well I feel. So my takeaways. My story, like many others, is full of ups and downs, 1 step forward, 2 step back. But what I've learned from this journey since 2017 is that I am responsible for my health. And I'm not saying that we are responsible for what happened to us. We don't deserve getting this diagnosis, but we are the only ones who can make that decision to change our outlook, to decide that we want to get better. No one else can make that decision but you, and no one can unwind your stress for you. you have to do that work yourself. And so for me, the functional medicine doctor, the primal trust, the EFT, the meditation, those are all things that work for me. And I wish I could say that this is the solution and that everyone here should do this, but I know that everyone is different and you're gonna have to try things on your own and learn what works for you. And the best I can do is share my experience and hope that it inspires you to do so. And another important thing that I learned is that we don't have to marry our disease or our symptoms. We have to talk about it at events like this and with our doctors to manage them, but if we give them too much energy, they can consume our thoughts and become our identity and something we hide behind. But you don't have to be your diagnosis. You can just be you, and that can be a part of you that you're working on. And this stuff is hard. I did it in high school and college when a place where self-care is not valued and drinking is highly valued. And I would just have to remind myself that prioritizing my health is going to pay off so much more for my future. And I'm just different. And everyone's got stuff going on, and this just happens to be my stuff. And I've also found that you can be the life of the party without partying. So the image I chose for this last slide is my dad and I at a sports bar together in Australia, pregame for the US women's national team. And I ordered a pot of tea. And that's me with my teacup and my dad cheering. And I ordered the tea. I walk out from the bar with my pot and my cup, and everyone's like looking at me like, what the hell? Like, what's going on? I'm like, yep, that's right, got my tea. And it just kind of like shows you can bring that silliness and that fun to a setting like a sports bar without consuming alcohol, without partying per se. And so to conclude, I am still living an amazing life. It just looks different now. Thank you.
Great. Thank you so much, Caitlyn, for such an awesome talk. If you wouldn't mind taking a seat, we're going to move into the last patient panel. I'd like to invite Arisha McCrae up to the stage as well. The kind of focus of this patient panel is to kind of expand upon Caitlyn's journey, but also hear a little bit from Arisha, from her journey in consideration of clinical trials in AIH as well. And while Arisha is coming up, I may start asking Caitlyn some questions. So I think, Caitlyn was a part of the planning committee for this conference, and it's always been important for us to engage, think about, consider alternative medical strategies. Again, this is a little bit different than what we see probably more commonly in the liver clinic. But I think those with experience, those that have had patients that have seen benefits regarding some of these strategies, definitely we raise our eyebrows. And again, what are we missing? So maybe if I could just start off, Caitlyn, you decided to pursue this alternative strategy. I think a lot of people like to know, where did you start? Like, how did you find this doctor of functional medicine?
Right. Well, like I was mentioning, I was suffering a lot from the acid reflux. That was my main symptom, and no one was thinking that it was liver related, so I had to outsource. I was looking at all these different things. My hepatologist is also a gastroenterologist, and she just didn't really know what was going on either, because she was busy and things happen. And so I tried all those things on my own, like the autoimmune protocol, and then I was like, let's look for a naturopathic doctor, maybe they can help. And then we had a recommendation for this functional medicine doctor because she's a friend, or she's my sister's friend's aunt, and that's how I found her. And she has helped, and it was funny because she's like, what's your main concern? And I was like, acid reflux. She's like, it's not the autoimmune hepatitis? I was like, no. Fix the acid reflux.
No, that's really helpful. Arisha, a little bit of a different direction from what Caitlyn just said. If you wouldn't mind, introduce yourself, and then maybe we could talk a little bit about some of your decisions moving forward to some, not alternative strategies, but an alternative treatment to AIH in a clinical trial. Would you mind sharing a little bit about your story?
Hello. Hi, everyone. My name is Aricia McCrae, and I was diagnosed with AIH in 2017. I have been suffering for quite a while, from like 6 to 8 months, but I'm a registered nurse, and I know I have some registered nurses out there, and you just tend to, just kind of diagnose yourself, and you try to, keep going, and you keep going, but it had gotten so intense, the fatigue, the nausea, the vomiting, the loss of weight. I think I lost about 40 pounds, in a couple of months. I wasn't interested in doing anything, and I had 3 grandsons at the time that was staying with me. My husband, he's on the road all the time, so it was just, it was me and, trying to take care of them. And anyway, to make a long story short, I thought I was having gallbladder issues, and I was like, oh, crap, I'm going to have to go have my gallbladder out. My mom, I used to call my mom in the morning time, and I'd tell her how bad I felt. I would get to work and sit in the parking lot and cry because I felt so bad. And, went to my primary doctor. They drew some labs. They called me back the next day. They told me, go to the hospital right now. Don't stop for anything. Don't get a bag. Don't eat. Just go to the hospital. I got to the hospital. They were waiting on me. I had labs, AST. They were in the thousands, 2000s. But I was still smiling. I was laughing because I'm a nurse, and you just have to continue to go on, and you have to put on this facade that, everything's okay. And they were like, you can't be smiling. You can't be laughing. I know you feel bad, and I did. I felt really, really bad, and hence, after a lot of labs, a lot of tests, liver biopsy, I was diagnosed with AIH.
Thank you for sharing. And just to expand upon that, before we return to Caitlyn, I think you've shared with us on other online kind of formats that you've tried other strategies and maybe not traditional approaches to treatment of your disease. Has your disease been hard to treat?
My disease is very hard to treat. I've tried. I've been on the azathioprine. I've been on the budesonide. Didn't work for me. I take it, flare up, high doses of prednisone, as high as 120 milligrams in the hospital. Very high doses, kind of wean it down. As we're weaning down, get to a certain milligrams of prednisone, and everything goes back up. Right now, I am on prednisone. I am on tacrolimus. I am on methotrexate 3, and nothing really. And I've also been on rituximab, the injections and everything. Nothing just really works for me. I tell my doctor I'm his problem child because, if something can go wrong, something will go wrong with me. I might float, start on the medicine, float for a little while, be doing fine, feeling okay except for the fatigue and everything, and then boom, I just kind of plummet. So, yeah, I've had those.
Yeah. So in line with both of you, Caitlyn, we know you've done some alternative things, which I'm going to ask you a little bit more about. Aricia, have you tried anything that's non-traditional, either supplements, strategies?
My mom, who's she's not here today, but my mom, she is a big advocate of supplements and diets, and she was like, okay, there's this avocado thing. Let's try the avocado. Let's try this beet diet. They say beets have so many properties, and then mushroom, and then ginger. She's, just kind of, old-fashioned, and, she's also a registered nurse, too, and she hates to take medicine, antibiotics, anything, so, she's tried me on so many, she's even tried me, she's like, take this. It was like a little droplet, I forget what it's called, but it was supposed to promote energy for me. Oh my God, I forget what it was, but Yeah, she's always researching and, trying to find something else besides, the medicines that I take.
So we know Mama is a good resource for you, and Caitlyn, how you've kind of sorted out to where you find things. But you found some things that worked, and I think the gratitude piece was really interesting part of your talk. How did you decide to choose that and move forward with it?
Okay. Are you talking to me?
I'm talking to you.
Okay. Sorry. The gratitude piece. How did I decide to move forward with that? So, Stephanie, the functional medicine doctor, when I work with her, I also get 2 sessions a month with a nutrition coach and a therapist. The therapist recommended a morning routine to rewire your brain. Start off with a meditation right when you wake up, and then do this gratitude app. Because the thinking, I'm pretty sure it's scientifically proven, but when you're feeling gratitude, you can't feel anxiety. You can't feel stress. So the more that you can put your body into that state, the better you're gonna feel, most likely. Because the more stressed out you are, like your body's on high alert, you can't really relax, your symptoms will probably be worse. I mean, if people notice that their symptoms are worse when they're stressed, trying not to be stressed is definitely helpful.
What have you tried that hasn't worked in terms of that realm of complementary strategies? Anything off the top of your head?
Yeah. The AIP diet helped with my sinuses, but not with my reflux. So, but I mean, again, everything's individual specific, but I haven't tried anything that hasn't not worked, just things that are less effective than others.
So, Aricia, with your hard-to-control disease, what are the next steps with you and your doctor in terms of trying to control or lower your dosage of prednisone?
I am going to try the Kezar, the Portillo study, the Portillo study, because I speak with my doctor all the time, and I tell him I want to get off prednisone. I'm just tired of it. I'm sick of it. So for a couple of months before, he talked to me about the study and everything, and I thought about it, and he said, I'll just give you time to think about it and everything, and there's nothing that's really working for me, so, I have to try to take the next step, and, he was telling me about this study, and my mama, she researched everything. She researched the company. She researched the medicine. She gave me this packet of about 100 pages on the on Kezar and the Portillo study, and she's like, I think this would be wonderful for you. I think you should try it. So she was very instrumental in me, even thinking about trying this study.
Yeah. Do you have any fears about being in a clinical trial?
I do. My number one fear is, in the trial, they explain to you that it's a double-blinded study and that you would, you have a possibility, it's a 2-to-1, so you have a possibility of getting the placebo versus the medicine. Me, I want to get the medicine, up front, because if this medicine helps me, if this medicine works for me, off the top, I don't want to get the placebo. I want to get the medicine, and try to see if this is one that can help me, and basically that can just help me get some of my life back, because my life has just been turned upside down with this AIH, and that's my concern there.
Yeah. Thanks for sharing and being so transparent. Kind of last question before I turn it to the audience if they have any questions. Caitlyn, now that you've engaged in some of these things and you talk to more traditional doctors, do you ever feel like there's any stigma about your strategy, employing them? How would you talk to a doctor that didn't agree?
Well, I've had that experience where they want to kind of cross-check whatever the other doctor or practitioner is suggesting. And even my functional medicine doctor, my acupuncturist wanted to give me herbs, and she was like, no, you're not taking those, you're already taking this stuff. So I think honest and open communication, whenever I do that, my doctors are very understanding. I don't often get shut down. They usually want to know what I'm doing. And if it's working, they're down for it. If it's helping, they're like, yes. And I will say that my liver doctor, Dr. Ree, when I was telling her about the Primal Trust, she was a big fan of it. Because it's a program that's designed for people who are jumping from protocol to protocol, who can't seem to figure out their symptoms, because it's a whole nervous system regulation program to give you the tools to reset. Like you were saying, when you think about when you have to go on a walk, you're already worried about that. It's supposed to help with those kinds of feelings so that you don't, manifest a bad outcome because of all this trauma that we've undergone having these kind of diseases. And I'm not trying to force this on anyone. I'm just saying it's helped me a lot. And my liver doctor was like, maybe I should start doing it so that I can teach it to my patients. That's how powerful it is.
No, that's great perspective. Can I ask, is there any audience questions for Aricia or Caitlyn about clinical trial, complementary alternative medical strategies? I think you guys gave a really good perspective, and Caitlyn, your talk was excellent. Aricia, thanks for being transparent about your disease. But we'll move on to the final talk. Thank you.